Welcome to The Explainer. Today, we're diving into how doctors solve medical mysteries in their youngest patients. This is the big challenge for pediatric radiologists. They're kind of like detectives reading visual clues in medical scans. They use a really powerful method, linking a visual clue directly to a diagnosis to save precious time. All right, let's dive into our first cases, newborn breathing problems, where literally every second counts. Okay, here's our first clue, a classic sign in a newborn who's struggling to breathe. So, what's it mean?
That clue points straight to transient tachypnea. It's basically a temporary breathing issue that resolves pretty quickly. This is often linked to C-sections. Why? Because less lung fluid is squeezed out during birth. It's a key hint.
All right, next case. Now, the scan shows this kind of ropey appearance, basically thick streaks in the lungs.
And that ropey clue, it points straight to meconium aspiration, a very serious condition for a newborn.
Okay, let's shift gears to tummy troubles and see how this method works for abdominal mysteries. This next clue is one of the most iconic in all of pediatric radiology. What could it possibly be? That double bubble, it's a near certain sign of duodenal atresia, basically a blockage in the small intestine. And here's something really interesting. This specific finding has a very strong link with Down syndrome. Now, this next clue signals a real medical emergency. That corkscrew shape is a huge red flag for surgeons. The diagnosis is midgut volvulus. That's a life-threatening twisting of the intestine that cuts off blood supply. Sometimes a pattern of clues that seem totally unrelated actually point to one single underlying disease. Okay, so let's look at 3 separate findings. At first, they seem completely unrelated. What's the connection? Our first clue is an infarcted spleen. That just means the spleen has lost its blood supply. Okay, clue number 2, gallstones in a child. This is super unusual in an otherwise healthy kid. And our final clue, really bad pain and swelling in the hands or feet of a baby. So what's the connection? All 3 clues point to one diagnosis, sickle cell disease. So, why does this kind of instant recall matter so much? Well, it's all about speed and saving lives. And this isn't just trivia, it's a trained skill that lets doctors act decisively when it matters most. It really makes you wonder, what other secret languages are doctors using to turn clues into cures every single day?